Hi there, and welcome back to the Reset Mantra with me, Sabina Maharjan. Today's episode is for every woman who has ever wondered about her fertility, whether you're single, married but not ready, or thinking about starting a family soon. But especially if you're single in your 30s like me. This one hits close to home. After a major life reset in my own 30s, I found myself asking, what does my fertility future look like now? Should I freeze my eggs? Is it too late? Or can I trust my divine timing and still be prepared? That's why I am so honored to bring on Dr. Amy, also known as the Egg Whisperer. She is a renowned fertility specialist with degrees from UCLA, Harvard, and the University of Michigan. She's the only fertility doctor licensed in all 50 states in America. Dr. Amy has taken a once confusing, overwhelming topic and made it accessible through her signature methods that help break down fertility basics for both women and men. Whether you're just starting to think about your options, unsure where to begin, or simply want to understand your body better, this episode is for you. So without further ado, please join me in welcoming Dr. Amy. Welcome, Dr. Amy, to the Reset Mantra. I am honored to have you on my show.
Thank you, Sabina, for having me. It is my honor to be here talking to you.
So, Dr. Amy, to begin with, as a fertility doctor and specialist, the one of the best we have in the country, what is egg freezing and why do some women choose it?
Egg freezing is a way to preserve your fertility by freezing your eggs. A lot of people know what IVF is. Egg freezing is just the first part. When you go through IVF, just like egg freezing, you take medications to grow your follicles so that you can retrieve the eggs. And then what happens on the day of the egg retrieval, you can either freeze them or another F word, fertilize them. So it's the same process. Egg freezing gives women a chance in the future to give themselves a better chance for pregnancy. Some people call this fertility insurance. I think that's wrong. I call it fertility assurance. You're giving yourself some sort of reassurance that you can have a better chance of pregnancy when you're older using your younger egg. So in a way, you can be your own egg donor. I predict my children, they're not going to have kids until they're 50, and that's going to be normal. That's what I think, because I see more patients now over the age of 45 than I've ever seen before. When I started my practice, my average patient was 32, and the only way a 50-year-old can have a baby with her own eggs with the technology that we have today is to have frozen her eggs. So that's basically what egg freezing is. It's just a way to preserve your fertility so that you can have a better chance for pregnancy in the future. And there are a lot of reasons why people do it: for career, because they haven't met the right partner. And I think that's probably the single most common reason that my patients have when they come into me for why they're freezing their eggs. They're doing it for themselves because they want to protect themselves. They want to protect themselves from making the wrong decision about a partner because of some clock that's ticking in their ear.
So, what's the success rate of the egg freezing?
It really depends on the age that you're at when you freeze them. And I have a really cool tool. It's a little calculator. It's online. I plug in my patient's age, the number of eggs that I predict that I'll be freezing for her that are mature, and then I can tell her what the percentage chance is that she'll have one baby with that set of frozen eggs or two. And what I'd like to do is design a plan for my patient that will give them at least a 50% chance of having two children from the eggs that they have frozen, because that just feels comfortable and right. So many women, they freeze and forget. They just do one egg freezing cycle, maybe when they're 34, and then they thaw their eggs at 44 and wish they had frozen more. So that's why I take this approach, because of so many heartbreaking stories that I've seen from patients who come to me after having frozen their eggs, ready to use them. So this is how you can protect yourself from fertility regret, is by freezing enough eggs so you can have two kids from the batch of eggs that you have frozen. If, let's say, you're 28 years old and you have 10 eggs frozen, there's probably like a 75% chance at least that you're going to have a healthy baby from that batch of eggs. If you're 38, it's more like 25%. Right? So it really depends on your age. So women who are older have to freeze more eggs and do more rounds. Women that are younger freeze less. They don't need to freeze as many as an older woman because their eggs are more viable. The younger you are when you freeze, the healthier your eggs are.
How early do women start to freeze their eggs, or do you recommend?
I would say between 25 and 28 is a good age, but I don't think women need to rush to freeze their eggs in their 20s. I think 32 is a pretty good age. If you're thinking about freezing and you're getting close to 32, I think that's a nice age to freeze your eggs at.
As I was mentioning to you a little bit before we hit the record button, so I found myself newly single at the age of 33, and I'm 35 right now. So I never had to think about, okay, I gotta freeze my eggs and, secure my fertility journey. So at 33, I found myself with zillions of questions, not knowing what my next step is, leave alone about my fertility status in future. A year ago, one of my very close friends, she gently raised this question about, have you thought about freezing your eggs? And it was a very scary thing for me. And as I was mentioning to you earlier, I had just heard of the concept egg freezing, and I had no idea how to begin. I had no information, and I was scrolling through social media, and I believe this woman was sharing her process of egg freezing, and it seemed painful. It was maybe in addition to the physical pain that she was walking us through, there was also seems like emotional pain. So I was very, very reluctant, very skeptical whether this was for me. What would you recommend, or what would you tell someone like me, who's going through this process, the state of unknown, the
So
best
easy.
step?
One phrase, knowledge is power. Test and don't guess. While it might be scary right now, it's a heck of a lot scarier to face infertility. And getting to know your fertility and learning about egg freezing doesn't necessarily mean you have to freeze your eggs, but I think every woman should at least know what the process is and know about their fertility. Because if you know what the process is, then you kind of get to learn more about fertility as you're educating yourself. Because a lot of people don't know about follicles, they don't know about the AMH level until they start the egg freezing process. But these are standard tests that we do to assess someone's fertility. They help us predict when someone's menopause could be. And these are all interesting things that I think every woman should know. I mean, heck, I'm 49 and I'm still checking my levels just because they're helpful to me. I want to know when I'm going to go into menopause. So I feel like it's important to reframe the conversation that whatever you're going to learn, you can handle it. Knowledge is truly powerful. And wouldn't you rather know now than find out after a year of trying to conceive that you were running out of eggs? It would have been much more helpful if you had known sooner. So don't be afraid to get tested. Don't be afraid to get an exam. Realize that this is an emotional process, and sometimes you'll learn things that you didn't expect. And these numbers can sometimes affect us emotionally because we are all overachievers and high achievers. And so we want to score really high on these tests. But fertility is one of those things that's just out of our control. You're born with a certain number of eggs. We lose them over time. Some women run out faster than others. And it's not your fault if you run out of eggs faster than your friend. It's not a competition. This is just all about you, your journey. And it's important to be empowered by the information so that you can have it so you can plan your future.
So I know very little about, how women are born with a certain amount of eggs, and with time, the number only grows less. Have you seen, cases where the number of eggs actually grow, depending on the lifestyle, diet, and health status?
Yeah, I mean, there are things that we can do to support egg quality, certainly, and there are things that can potentially slow down egg loss. There's a supplement that I recommend to my patients called OVA NAD+. This is a supplement that repletes NAD in our cells. It has nicotinamide riboside titrate in it, and this has been shown to increase AMH levels, and it might help also increase follicle counts. That's one thing. And the second is something called CoQ10, CO, the letter Q, and the number 10. This might also help support egg quality and may slow down egg loss. So I have a theory that my patients who I've seen in their 20s, and I tell them all to take these things, and I say, don't stop until you're done having babies and even beyond, because there is a longevity benefit to taking these supplements. I predict that maybe those women will have less difficulty getting pregnant, maybe less miscarriages, and less fertility issues down the road. Lifestyle certainly helps, keeping your stress down, exercising, taking really good care of yourself, thinking about your sleep hygiene, hydrating well. I mean, that just makes sense just from an overall health perspective. But at the end of the day, a lot of times, even when you do these things, we don't have the control that we wish we had. Because I have patients that say, I want to work on my eggs before I do this or that. And I wish it was like every other assignment in life. Like, you can say, I really want to work on my bicep muscle, right? So what I'm going to do, I'm going to do curls at the gym. Like that works. But when it comes to these things, there's only so much you can do. At the end of the day, a lot of it has to do with your age and genetics, and those things are out of our control.
So, I want to pivot the direction of conversation a little bit towards where I was reading that you host egg freezing parties. This
Yes.
was is tell us a little bit more about that. I thought that was very interesting.
Yeah. In 2014, I just came up with this idea because back then, not so much now, but there were all of these home shopping parties. There's the passion party, where people were selling vibrators at home. There was the jeans party, the purse parties. And I was always getting invited to these parties. But anytime I would go to a party and people find out what I do for work, and I love talking about what I do anywhere I go, it would almost turn into a fertility education seminar. People are asking me about their fertility, telling me their stories. So I said, how about I just throw parties just to talk about fertility? And so that's where the concept came from. And I felt like egg freezing was just something that people just didn't know enough about. So I started egg freezing parties where I would throw them in really nice restaurants with private rooms. And it was just basically a scientific presentation with a bunch of really smart women, sometimes men too. And then it would turn into a Q&A at the end. And you could see women bonding. A lot of people became friends after the parties too. It wasn't to sell egg freezing to anyone. It was truly just part of my public awareness and education mission around fertility and egg freezing. But the word is out now. I mean, it seems like everyone knows that egg freezing is an option, especially in the Bay Area. If you take like 10, 35-year-olds, I would say probably 50% have done it. I mean, that's how high the conversion rate is, or the acceptance of egg freezing is now. I mean, back 15 years ago, though, I'd probably say 1 out of 10 would have frozen their eggs, if that. So I think the word is out. All those 40-year-olds that were dealing with fertility were screaming at all their 30-year-old friends loud enough that they listened. And now I just do them online. So I have a school called eggwhisperschool.com where I throw these quote unquote parties, but they're online, where it's basically a PowerPoint presentation and a live Q&A where I talk about fertility, including IVF as well.
For those who are listening, if they're wondering what exactly goes into the process of egg freezing, can you help us understand a little bit what that looks like and the timeline that it takes and, all the deets?
Absolutely. So it starts off with the pre-egg freezing ultrasound, where we do an ultrasound of the uterus, the ovaries, and we count the follicles. That's called the antral follicle count. Antral follicles are tiny cysts that contain an egg. And what we do is we have a woman take fertility injections, and these are hormones to help grow these tiny cysts or follicles to the point where they're about 18 millimeters in size, so that the egg inside is mature. You can't just take a needle, put in the ovary, and expect to get eggs that you can freeze. You have to grow them over time. So the time is usually around 10 days or so of injections that a woman takes daily. And while you're on those shots, we do ultrasounds. These are pelvic ultrasounds looking at the size of the follicles, and we can adjust the medications from one day to the next. Typically, it's about 4 or 5 ultrasounds before the last visit, which is the egg retrieval visit. That egg retrieval is done under anesthesia. It's just like a nap. A pelvic ultrasound while you're asleep is what I describe to my patients, and we do basically what's like a blood draw from your ovary. So a tiny needle goes in, we aspirate the eggs from the follicles that we see. The embryologist then sorts through the fluid, identifies the eggs, and freezes them that day. And then we can tell a patient how the eggs looked physically. We can't tell about genetics, unfortunately. And then we can tell a woman how many were frozen. And then I always talk to my patients about their goals. Did we get enough eggs? Did we learn anything that would be helpful for the future after going through this cycle? Should we do more cycles? So doing a post-egg freezing consult is also really important with your doctor if you're going through this process. So basically, it's a total of about 2 weeks, injections every night, about 5 ultrasounds, and then the egg retrieval procedure.
How painful is that?
I
Very
mean, the
nice question.
procedure yeah, I mean, the procedure itself is not painful because you're asleep, you're under anesthesia, but you can certainly get bloated. I mean, patients describe themselves feeling like a puffer fish, poofed out. You kind of go from 0 to looking 4 months pregnant with an egg baby over the course of 2 weeks. And typically after the egg retrieval, the bloating can stay there, especially for young women with lots of eggs, for about 2 weeks or so until it completely goes away when your period is over.
What are some of the biggest misconceptions that you've seen women have about egg freezing or their fertility?
One of the big misconceptions is that an egg equals a baby, and that's just not true. So it can take several eggs to even make one embryo. An embryo equals a chance for a baby, but it can take even 6 eggs to have one embryo that can turn into a baby. So that's one thing. That's why we have to freeze more eggs. The other misconception is going through egg freezing makes you go into menopause sooner. So by, let's say, retrieving 10 eggs, a woman will then say, I've heard this said before. Oh, does that mean I'm going to go into menopause 10 months earlier? And that's not true because we're just rescuing eggs that, you would have lost anyways that cycle. Another misconception is that egg freezing is a guarantee. It is not. We already kind of talked about that, but it's important to understand their limitations with technology. And anytime human beings are doing something, things can go wrong. Maybe they won't get frozen correctly. Maybe the thaw won't go well and they won't survive. And then the other thing is you can use your eggs forever. That is true. You can, but your uterus might not be able to carry your pregnancy forever. So as you get older, there are things that can happen like fibroids, endometriosis. And so if you have those things, while you might have frozen eggs that were healthy and young, your uterus might not be able to hold a pregnancy if you wait too long. So just kind of making sure if you've done egg freezing, also make sure that your uterus is healthy and it's okay to wait. So what I tell my patients is if you've frozen your eggs and now you're finding that you're over the age of 37, do another evaluation and make sure you're not missing anything. So I would hate for you to wait until you're 46 and find out that you should have at least carried a pregnancy earlier. And if you wait over the age of 40 to carry a pregnancy, and that's okay. A lot of women are doing that these days. More women over 40 are having babies than women under 25. It doesn't mean that women over 40 are more fertile. It just means that our society is shifting when we do things. So I think that it would be a good idea to not just freeze and forget, but freeze and still think about your fertility as you're getting closer to the age of 40 to make sure you're not missing a new diagnosis that you would have wished you had known sooner before you make those big decisions about waiting longer.
Mm. You mentioned something about embryo freezing. What's the difference between egg freezing and embryo freezing?
They're the same thing. So egg freezing is the first part of IVF. So it's the same. So when you're going through IVF, you're going through the egg freezing process. But on egg retrieval day, if you're doing IVF, you're just effing the eggs, which is fertilizing, and you're making embryos. So it's the same process. So women who do IVF are basically egg freezing patients as well, except after the egg retrieval, the eggs get fertilized. So for women who are going through egg freezing and they have eggs frozen, they have to then undergo embryo creation later. So that the eggs have to be thawed, fertilized, cultured. So the embryos have to grow. Think of embryos like little kernels of popcorn, right? So they slowly over time pop in the incubator, which is like the microwave. And then once they get to a certain stage, we can transfer one and freeze the rest, or we can freeze all of them and genetically test. So you have a lot of different options. So some women who, let's say, come to me at, let's say, 42 years old and they want to freeze their eggs, I'll often encourage them to freeze embryos at that age rather than just freeze eggs because embryos are a lot more stable than eggs.
Hmm. That's definitely good to know. Choosing not to have, right information in today's world is basically ignorance, right? But also, a part of me tells me that, okay, Sabina, so what about faith, right? Like, can faith and science coexist when it comes to fertility? Like, if I'm saying that, okay, I believe in my divine timing, and if it's meant to happen, it will happen. I just gotta trust the universe and just believe in my timing. What would you say to me?
Absolutely. So I say whether you're religious or spiritual, you can still freeze your eggs. And the way I think about it is I do God's work every day through my hands. Science provides me the tools and faith provides me the strength and the purpose. Without my faith and spirituality, I don't think I could provide the type of care that I give my patients. Certainly there are patients that come from certain religious backgrounds that quote unquote allow them to do certain things. And so it's really important if you're one of those patients to talk to your doctor about what your beliefs are so they can honor them and make your priorities theirs. So that's one of the first questions I ask my patients. What are your priorities? What are your beliefs? What are you willing to do to have a baby? And the good thing about egg freezing is that most people, depending on their religious background, it is acceptable, except for some cases. So you can design a program with your doctor based on your religious background and faith that suits you. you. But I think it's important to know that, certainly I see miracles every single day, but it's the science that allows me to perform those miracles.
Another question. So if, let's say, if someone's not um, emotionally ready to go for the egg freezing process, how often should they revisit their fertility status?
Yeah, so I would say really work on why you're not emotionally ready if you really want to do it,
Mm,
and work with a fertility therapist. So, fertility therapists are knowledgeable experience in guiding patients along their egg freezing journeys as well, not just for patients with fertility struggles. And so, I actually send my patients a list of questions to review with a friend, family member, or a therapist. And one of the questions is, are you emotionally ready to go through egg freezing? Are you emotionally ready to even get your fertility levels checked? How would you feel if you find out that you actually had a low egg count? How would you feel if you found out that you got less eggs than you would expect? How would you feel if you go to use your eggs and they actually don't work? So I think having a coping strategy for each of those things that could happen is really important at the start of the process. So what you have to do is detach your emotions from egg freezing and have your coping strategy. And everyone copes differently. What I don't want people to rely on is alcohol and drugs and trashing their body and, ice cream. I want them to cope with like really healthy exercises and mantras and prayers, whatever suits you. I have mine. They're really easy when I feel overwhelmed by information. It's don't worry, be happy, and just know that you have to let it go, just like Elsa sings in her song, you have to let it go. Just know it's not in your control. So I think that's a very important point. And so for people that are not emotionally ready, I mean, honestly, I'm not sure that checking levels is going to help, right? I mean, checking your levels in the future is just going to scare you. So just really work on why you're not emotionally ready. And certainly do check your hormone levels every 6 months or a year. But the thing is, you don't want to react to levels that are dropping. I mean, the levels, they meander and they're kind of mean because as you get older, they do go down. So you want to freeze while you still have a good egg count, not because you're running out of eggs and your time is, and you have less.
mm. A question that I have is so something that I've been lately seeing in social media is, let's say someone's, oh, I'm 35, but my biological age is 15 or 20. Does that mean their fertility status is of 15 if
Nope,
their biological age is
not at
15?
all. I mean, it doesn't matter how amazing you look on the outside and what your biological age is. Your eggs are the fasting aging cell in your body, and everyone runs out. Doesn't matter how amazing you look. Your ovaries have no idea.
Mm, mm. What do you think about, how in today's world of AI or new tech, is the fertility care shifting? Have you seen that in your
I mean,
practice?
it is a little bit with tools in the lab. We use AI for semen analysis and cool things for sperm. There's some clinics that use it to grade eggs. Not all clinics do. There's AI technology for egg storage and embryo storage. So I think it's making our process in the office more efficient in terms of how we see patients with what we can do from a day to day basis. I worry that it's going to replace fertility doctors and the consulting that patients get with a doctor in the future because there are so many fertility patients out there and not as many of us. And I think maybe that human touch is going to be less and less because of AI, but certainly there's going to be doctors like me that still want to talk to people. But yeah, I mean, it's an exciting time to be living, seeing how AI can help patients.
Mm, I would definitely insist on having a human doctor. I
Yeah.
cannot imagine, sitting with a robot and talking about
Amy
this.
Avatar, a Dr. Amy Avatar. I mean, I've had companies come to me asking if they could create my avatar and I could do consults and it wouldn't be me. And I'm like, I don't want to do that, but thank you.
Oh, well, that's very interesting. Is it like, are they talking about like creating a bot for you
Yeah,
or?
a
Oh,
bot. Yeah, and
wow.
generative AI taking all my like just basically learning how I talk and the recommendations I make, how I process information and decide what plans to use for different patients and protocols and just automating that into a avatar.
That they can have like as many copies or clones of Dr. Amy they would like.
I know. It would be nuts.
Wow. That's very, I mean, it's as interesting as it sounds. It also has a lot of red flags there, right?
Yeah, because that bot did not go to medical school. That avatar can't do an egg retrieval.
Yeah, yeah. So Dr. Amy, something that I found, in your past conversations is that you often say fertility is proactive and not reactive, right? Um, wh- what do you say, like, what basic steps should a single woman take to get more clarity on her fertility status today?
Yeah, I mean, easy thing to do is a pelvic ultrasound. Look at your uterus, see if you have any things that are fertility threatening, like fibroids, endometriosis, adenomyosis, or PCOS, and get some fertility levels checked, like your day 3 FSH, estradiol, AMH, and do some genetic screens, like a carrier screen for autosomal recessive genes and a chromosome analysis. So, those are the basic tests that I offer patients who are interested in just learning more about their fertility when they come to me.
And I also saw that in your website you have various methods,
Yes,
which is very interesting. There's
yes.
Ball's method and multiple other, which of course you aim to, provide people like a simplified version of fertility education.
Yes, I also have the Egg Whisperer consult. So this is for young, I mean, any woman, doesn't matter your age, who's just want to get her levels checked and want to get my perspective on what they mean for her. I also have new patient consult, and I also have a program called Freeze and Share. So this is for women under the age of 30 who want to have their eggs frozen for free in
Hmm.
exchange for donating half to a couple that would be a recipient, a single person or a couple who would be a recipient. So those are the different offerings. So anyone who wants to see me can just go to my website. There's a contact form on there and they can fill it out and then explain what they want to see me for.
Oh, I think that would be very interesting. I'll make sure to put that link in the show notes so people know how to connect with you further. Um, I've got a couple of more questions for you. So we talked about, from single woman perspective. Now, for those like who are in relationship or who are married, but not yet ready to be parents, do you see married couples come for egg freezing as well, or what have you found?
Yeah, so what I asked the couple is why they're not making embryos. It could be for religious reasons, but it could also be maybe there are problems in the relationship. So if I see a couple, I'll always ask like what is the likelihood that you'll be together in 5 years from now? If it's anything but 100%, I highly recommend egg freezing. And the reason is a man can have kids until he's 90. I mean, he'll always have sperm. Whether it's healthy or not, that's a different question. But a woman will run out of eggs. 100% of us, all of us will run out of healthy eggs. Most of us by the time we're 40, and almost all of us by the time we're 43. So, with those numbers in mind, if you've tied up your eggs with a partner that you're not 100% about, then you're basically just taking away your fertility. All that hard work that you put into, if you made embryos with him, could go out the door. So I always tell patients who are married and struggling in their relationship, freeze eggs. You don't need his permission. And sometimes it's the guy that's like not ready to move forward. He's not ready for kids, but he's really just wasting a woman's time and wasting her fertile window by, not being ready. And it's really his problem and not the woman's problem. So if you don't see eye to eye on when you want to have kids, but you still want to stay in the relationship, then I would freeze eggs. And I think that's an important question to talk about even before you get married. Like, when do you want to have kids? How many do you want? What are the treatments that you're willing to do if, let's say, one of us has an issue? So I think talking about that even before you get married is important.
Mm, those are great reminders. Very, very, very practical reminders.
Yeah. Well, I have a couple more. You don't need a man to have a baby. That's one of them. And you don't
Mm,
need to be married to have a baby either. However, you don't want to be dealing with custody issues for the rest of your life based on a bad decision. So if you have any doubt, don't make embryos.
yeah. And I think compared to how I thought about relationships in my 20s and how I am thinking about a relationship in 30s has totally shifted. I've come to believe that the whole point of being in a relationship or marrying someone is to have kids. I don't know, a lot of people may or may not agree, but
Yeah.
at least that's what my state of mind is.
Yeah. I mean, you want someone that will make your life better, honestly. And if for you having children is that, and that brings you happiness, which I think most people would agree that their children bring them um, so much happiness, then I think that's a really good statement. And you got to know yourself. Like everyone's different. And it's just you have to be true to yourself, be honest with yourself. And if you know that about yourself, then that's what you need to do is find a partner that you want to have children with.
Hmm. Yeah, for sure, for sure. So, Dr. Amy, I know the the title Egg Whisperer. I know you've got a very interesting story behind it. Would you mind sharing the story with our audience?
Absolutely. So, it's a patient of mine who gave it to me. She had given up on all hope that she would ever have kids. And she came to me and I said, no, I still think there's a chance. Long story short, I helped her have twins. And as a gift, she gave me the website eggwhisperer.com. She called me her egg whisperer. And then at one of my egg freezing parties she attended, and there was a reporter there and she whispered it in her ear. And she said, literally, that's my egg whisperer. And then all of a sudden there were like articles everywhere, Dr. Amy, the egg whisperer, throwing egg freezing parties. And that's how it caught on.
That was very thoughtful
Yes.
gift. Yeah, yeah. Also, I may have not asked you this earlier. How did you get into this field? Like, did you always want to be a fertility specialist, or was there a moment
Always.
that led you here?
I knew I was 12 when I wanted to be a fertility doctor. At the age of 3, I knew I wanted to be an OB/GYN. I come from a long line of doctors. My grandfather owned one of the largest maternity hospitals, followed by my father, who actually practiced in this room that I'm sitting in right now for over 40 years. He's delivered a lot of my patients and their babies, and he even delivered not the baby that I helped my patient get pregnant with. He's actually even delivered my patient. Like, I've had patients that I've seen in their 40s that my father actually delivered, and he took care of their mothers and even gave them fertility help. So it's just it's generational care. It's part of my family. It's part of my DNA, and I just couldn't imagine doing anything else.
Wow, that's really inspiring. If there's one thing that you would like the audience to take away out of this conversation, what would that be?
Have your kids as early as possible. Your career can wait. And I
Mm.
speak on behalf of the thousands of women that I've seen that prioritize their careers over family. I have these conversations all the time with patients, and they're like, well, I'm not ready for a baby because of my career, this and that. But I got to tell you, those patients who come to me later in life, they say, I wish someone had told me F the career. You should have paid attention to your fertility while you still had it. So that's just the one bit of advice I'd have for your listeners who are thinking about freezing their eggs. Really prioritize your family. Family really matters the most. That's what we're here for, to bring love into this world, to share love. Your career is amazing. It will always be there for you, but your fertility is fleeting. It is not permanent.
That's a wonderful reminder. One interesting thing that I learned that you're the only fertility specialist who has licenses in all 50
All
states.
50 states. So anyone, no matter where
Wow.
you live, can see me. And, I've taken care of people all over the country and world forever. But other doctors would say, well, she doesn't have a license in that state. And I said, you know what? And I spent the last 5 years doing it. Lots of exams, lots of money, lots of fingerprints, background checks, lots of tests. And I finally did it. So I have my license in all 50.
So, as we near the end of our conversation, I have 3 questions section, which I usually ask all of my guests, and it's just kind of a rapid fire. Okay, are you ready?
Ready.
All right. Okay, question number 1. If your mind was a galaxy, what kind of planet would you be living on right now?
A planet that had no hunger, a planet that had no poverty, a planet that had no war.
Very beautiful. Okay, second question. The universe just sent you a cosmic billboard. What message is written on it for you?
The message on my billboard is love more.
Love more. That's beautiful. Okay, third question.
Okay.
If you could place one thought, one belief, or a mantra into every human's subconscious mind tonight, what would that be?
That you're worthy. I think so many people are isolated, alone, depressed. They don't feel worthy. They don't feel good enough. And I think that they're worthy of love. They're worthy of having a good life. And that, I think, is probably one of the most important things that people need to learn about themselves.
Mm, it's wonderful. Yeah, this has been such a joyful and very informative episode. Thank you so much for your
Thank
time.
you,
I really do appreciate
Sabina.
that.
Thank you so much. You're so awesome. Thank you for having me today.
That was such a delightful conversation with Dr. Amy. I am so thankful for breaking the fog around fertility. If you feel behind, worried, or lost, this is your moment to pause, reset, and start a new path that serves you. Whether that means choosing to stay informed about your fertility, egg freezing, lifestyle change, or simply by trusting your timing. Thank you for listening. This is Sabina Maharjan, and I will catch you next time.